Thank you, Senator Tedisco. I'm proud to be standing here with you and my colleagues on this issue. And we appreciate your tenacious leadership on this critically important issue and for advancing this very necessary bill. I also want to applaud Janice Dean for her tireless, powerful, and principled advocacy in demanding accountability. Thank you. We're very sorry for your loss, for your family's loss, and we're honored here to be standing beside you today. Your perspective and your voice, which deserve to be heard, should never have been attempted to be silenced. It's so important what you have to say in informing the issue and informing the policymakers. I also want to applaud Democrat Assemblyman Ron Kim for being here and sponsoring this essential measure in the Assembly, showing that this really is a true bipartisan effort. We're here as part of an ongoing, growing effort to seek answers and demand accountability. The preventable deaths of 6,400 senior citizens due to the Governor and State Department of Health's reckless, irresponsible, and deadly mandate that forced nursing homes to accept COVID-19 positive patients is a staggering, incomprehensible loss for the families in my Senate district and around the state. That's over 6,400 lives and possibly double that amount that have been lost. And we still don't have the full, painful picture. Many families in my district and across the state are shattered and grieving. Our hearts go out to those families who lost a loved one because of the state's disastrous policy. What's especially troubling is that the Department of Health and public health authorities knew and were informed at the very beginning that the elderly and those of frail health were among the most at risk of COVID-19. Why and how could the decision be possibly made to bring the virus to their place of residence and care? It defies logic, reason, and plain good old common sense. Without question, the continued search for answers demands this common sense legislation that would create a bipartisan state commission to investigate New York's COVID-19 nursing home response and tragic deaths that took place. The commission would be empowered and expected to follow the truth wherever it leads and whomever it implicates, regardless of their power or position. The first responsibility of government is to secure safety and health for their citizens. On that account, for our nursing homes and the senior citizens who reside there, New York State failed miserably. The bill must pass before session ends, and it must become law so that we can ensure that the preventable tragedy that befell some of our most vulnerable citizens never happens again. I'm so proud to co-sponsor this bill and continue working with my colleagues to ensure its passage. Thank you very much.